We talked about this idea that public policy requires a lot of people working together to carry out public policy, but it's also really influenced by the passage of time. And policies that come before are definitely going to have a big role in shaping the policies that come afterwards. So, what we're going to do in this video is we're going to seek to understand a couple of different things. One, I want you to know who the policymakers are, who are some of the people involved in the process. But I also want you to understand policy as a process that's going to be unfolding over time. So we're going to be looking at the steps of that process in detail. And to do that, we're going to be looking at Obamacare as an example. So the Affordable Care Act that passed back in 2010. We're going to be looking at every step of the policymaking process, using that as one of the examples that we go into. And so really that's what we're going to be looking in this video. I want you to understand these two different types of policymakers. We've got policy advocates and policy analysts. And then we're going to go through each of these four steps of the policy process. So let's get on to the first one, and that's going to be looking at policy advocates. Now, a lot of people have preferences when it comes to policies. In fact, you probably have specific preferences that you like. Maybe you've voted in an election before. Maybe you've signed a petition. Most people have these preferences, but not everybody is a policy advocate. A policy advocate is going to be somebody who wants a specific policy outcome, and they're very involved in advocating for that goal. So one of the first things that we look at when we look at a policy advocate is this idea that they have an idea about what ought to be done. They already have a specific end goal in mind. So they have a set of goals or outcomes that they're trying to get, and they're going to start with that outcome and then try to find certain laws and policies that are going to promote that. So, there's a picture here on the screen, and on the left you have a woman who's saying, keep abortion safe and legal. On the right, you have a woman saying, I'm the pro-life generation. So both of these people could potentially be considered a policy advocate if they're working towards that goal for their stated preference, whether that be pro-choice or pro-life. Now, for policy advocates, you might also include lobbyists in this group. A lobbyist, of course, is a person or a group that's hired to advocate for a specific set of policies. So you could think of a lobbyist as, maybe working for the National Rifle Association. That lobbyist would be out there advocating for policies that would help gun owners, issues around the Second Amendment. And you could have lobbyists for groups like the Sierra Club who are advocating for policies that are going to protect the environment. At the end of the day, policy advocates are extremely influenced, and they want to influence policy based on their specific goals and what they think the objective should be. So we're going to compare policy advocates with the next one, which is policy analysts. Now, where advocates are motivated by their desired outcomes, policy analysts are supposed to be more objective. So typically their goal is not to take what they want to happen and then try to make that the policy. Their goal is to help decision makers to consider the pros and cons of different choices that they're going to have to make. So they're not taking their favorite stance. Instead, they're trying to be rational, they're trying to be objective and analytic, and they're going to make sure that lawmakers are fully informed. Before you make this decision, here are all of the ways that could unfold. So the image that you see here is actually a real screenshot from LinkedIn, which, as many of you know, is a professional networking site. And the man that you see here is an econometrician who works at the Congressional Budget Office. Now, this person's actual job is to use statistics and mathematics to study and model and predict how different policies are actually going to make an impact. If you pass this bill, what's that going to do to the national debt? How much is it going to cost? Are there other ways that you're not expecting that maybe it could impact the economy? So that's the goal. That's the job of this man here, who would be considered a policy analyst. He's going to study any given law that Congress gives him, and he's going to try to research what is going to be the impact of this law on the economy. Because he works for the Congressional Budget Office, that's really his job, is to help Congress understand the outcomes of what they're voting on. Now, there are other services that do this as well. Congress has another service called the Congressional Research Service that will study just about anything and prepare reports for members of Congress. You do also have other private organizations like think tanks in Washington, D.C., that hire researchers, and they're going to try to really study the issues and try to make recommendations on what issues, what policies might really help or hurt in different ways. So, in the simplest of terms, policy advocates are really going to advocate for what they want, and policy analysts are really going to help lawmakers and decision makers decide on the best course of action. So, you'll want to be able to distinguish the difference between those two. So, now what we're going to do is we're going to explore the policy process. There's 4 steps that I want you to be aware of, and we're going to go over each one of them in detail. And really, to illustrate the points, I'm going to be using the example of Obamacare as an example for each one of these. So the Affordable Care Act is a law that was passed by Congress and signed into law by President Obama back in 2010. And what it did is it attempted to expand healthcare access to people across the United States. So that's really what we're going to be looking into. We've got these 4 steps: agenda setting, policy enactment, policy implementation, and evaluation. Let's go ahead and dive into our first one, which is agenda setting. And that's going to be the first step. Now, in agenda setting, we have really sort of 2 parts. We have one part that's called problem identification. We have another part that's called alternative specification. Big picture, I really just want you to know that in this one, we're really kind of coming up with the idea, what is the problem that we want to address, and what are some potential ideas that we can use to solve it. So this first step is problem identification, and that really asks the question, what issues should be addressed by government? Not every single issue is worthy of having a law or something passed. So in problem identification, a problem arises, government officials become aware of it, and they make the conscious action to do something about it. So first, they're just kind of identifying what's the problem. The next step is something called alternative specification, and that's that once we agree on a problem, we have to try to figure out a few different ways of solving it. So for example, our textbook goes into this example of childhood obesity. Let's say Congress wanted to address childhood obesity. There's a few different things they could do, and when they're coming up with these alternative ideas, you could, spend more money for physical education and health classes. You could change school nutrition rules about what schools should be feeding kids. You can maybe pass new taxes on unhealthy food. These are all different things that could be done, and they're all going to have their benefits and their costs. So there are positive aspects and there are negative aspects of each one of these. The idea is really to find the best policy that's going to work that can actually be passed and implemented. So let's take a look at this example for Obamacare. Now, back in 2010, before this bill was passed, there was a huge problem of having uninsured Americans. 42 million Americans, or about 18% of the US population, were completely uninsured, no health insurance whatsoever. Now, these people were mostly young because remember, Medicare is going to pay the health insurance, the health care for older Americans, senior citizens. And these people also tended to be employed in sort of more entry-level jobs. A lot of Americans get their health care from their employers, but if you're working part-time or you're working an entry-level job, you might not get that benefit through your work. So that was a big issue. There was also this issue of medical costs. Medical costs had been rising for years, which was a problem not only for people who were paying for insurance, but also the government because they're spending this money on programs like Medicare and Medicaid. So back in 2008, the Democrats won control of Congress and the White House, and they wanted to address this issue. How can we go about implementing some legislation that's going to address the issue of healthcare? So they became aware of the problem. They're going to try to find some solutions, and that's exactly what they did. So this next step that we're going to look at is something called policy enactment. Now, right here, you see a picture of President Obama. What's he doing? He's signing a bill. This is the step that's really the most obvious to the public. It's going to be the most visible phase out of the 4 because it's going to involve the government actually debating the issue. You had Congress talking about the law. Are they going to pass it? Are they not? Is the president going to sign it into law? So there's a lot of public awareness at this phase. Now, policy enactment means that the government leaders are going to consider one of those specific solutions that we identified, and we're going to decide whether or not to pass that and to make it into a formal policy. And so when this was happening for the Affordable Care Act, they considered a number of different solutions. One of the ones that came up was sort of having like a single payer, everybody gets on a government healthcare kind of program. That was considered too costly, too controversial. It couldn't get enough support in Congress. So what they ended up settling on was this idea of, this comprehensive law that was going to make a lot of changes to how healthcare was done. The first one was going to be, you're going to have an individual mandate. And what that means is that every single American would be required by the government to purchase health insurance. And so that was a pretty big change. Now, before you had a lot of young people who maybe didn't think they needed it, this was going to sort of make that a requirement for everybody. The bill also increased taxes on some companies and high income earners. You couldn't ban, if you were a healthcare company, you could no longer ban people that had certain pre-existing conditions. Let's say, prior to this bill, if you had cancer and you tried to get healthcare coverage somewhere else, they might not cover the cancer treatment because you're coming into this policy with that pre-existing condition. So this completely did away with that. Anybody could get onto any healthcare and they would have to cover any pre-existing conditions that you had. Now, it's also going to do some things like open up some state health insurance exchanges. We're going to actually have these different websites where people can go on and they can shop for different insurance policies and try to buy the one that makes sense for them. You're going to have subsidies where the government's paying and helping low-income Americans. And finally, you're going to have, if you're a young person and maybe you're a college student, you can stay on your parents' health insurance until you turn 26. So this bill really, it made a lot of changes to healthcare in the United States. And ultimately, it was passed by both the House and the Senate, was sent to President Obama, who you see here signing the bill. So they did enact this policy. Now, they've enacted the policy. The next step is you have to implement that policy. And as you're going to recall from our week on the president, the role of implementing, who executes the laws, that's going to be the executive branch of government. So typically the executive branch, the executive bureaucracy, these agencies, they're going to do the work of actually putting that policy into practice. So what that looked like in the United States for the Affordable Care Act was a couple of things. Well, first, the law was challenged in court. There were some states who did not like this act. They sued, went all the way up to the Supreme Court. They basically said this mandate was unconstitutional, that you can't make somebody purchase something. The bill was mostly upheld by the Supreme Court, so it passed its first major challenge in the courts. The next step was really actually setting up how it would all work. So one of the ways this happened was they actually had these websites set up for all 50 states where Americans could go on and look at what are the insurance companies in their states, how could they purchase insurance, and actually going through the process of signing up. Now, in this implementation phase, there were a lot of problems. People got onto the website in the first few months and it would crash. There were, it was constantly running into problems. The website was going down. People couldn't get through. And so it was really kind of a controversial issue at the time. Now, fast forward about 4 or 5 months, those issues were largely addressed and fixed. But in terms of the rollout, it really had this negative perception by much of the public as a result of that. So we've got through our first 3 steps. Now let's look at our final one. And that last one is going to be this evaluation phase. In this stage, we're really asking, how well did this policy do what it was designed to do? Did it actually work? And so in this phase, you're going to do some research, you're going to do some studying, and you're going to find out, is the policy working well or not? There might be changes that need to be made. Or if it's working really well, maybe we can learn something. Maybe we can use a similar approach in other areas in the future. So this phase is really about studying it and seeing, are there any tweaks that need to be made? What's going well? What's not working so well? So in the Obamacare example, there was a lot of research that was done afterwards. And in terms of evaluating how well did the program work, you found that most people did continue to get their health care from either their employer or a pre-existing program like Medicare, like Medicaid. However, you did see a drop in the number of uninsured Americans. So where it was about 18% back in 2013, it went down even lower to about 8%, somewhere in the area of 8 to 10%. Is what we're looking at today in terms of Americans being uninsured. So we did have that number drop pretty significantly. However, the costs of healthcare have risen during that time. So we do have sort of this mixed bag. There's mixed outcomes. It's good that the number of uninsured Americans has dropped, but we've also seen the prices go up and continue to rise. So the price really hasn't been addressed. So that's going to give you a little bit of a feel of those 4 steps of the policy process. Now, I do want to note that when you're in that evaluation phase, sometimes you can figure out what's working and what's not, and it can go back and inform this next round. So something's not working. Well, guess what? That's going to be problem identification, right? And you can actually go through this process again and again. You can think of it as a cycle. It's this iterative process where when you evaluate, you're kind of figuring out what works and it doesn't. And that all feeds back into those early stages when there's any changes that need to be made with policy. I hope this has been helpful to you in terms of understanding those 4 steps in the policy process, and also in understanding the difference between policy analysts and policy advocates.